stroke diagnosis. Finally, let me just tell you a simple way to put a diagnosis of stroke. When you are putting the diagnosis of stroke, is it clear? When you are putting a diagnosis of stroke, is it clear? You must always say diagnosis is stroke. You say which one probably probably, if it is probably ischemic, is it clear? You have to say now the pathogenesis. Is it clear? You have to say the pathogenesis, whether it is atherosclerotic. Is it clear? You say whether it is atherosclerotic. You say whether it is cardioembolic. You say whether it is atherosclerotic. You say whether it's cardioembolic, or you say whether it is you say whether it's atherosclerotic, whether it's cardioembolic, or you say whether it's lacunar infarct. Is it clear? You talk about the three pathogenesis. Now, after talking about the three pathogenesis, you talk about the next one, which is the arterial distribution. Is it clear? When you are putting a diagnosis of stroke, talk about the arterial distribution. It can be the left middle cerebral artery, it can be the right, as I've already spoken to you, I've already told you the different arterial distribution that can be involved. Is it clear? Talk about the arterial distribution. Now, after talking about the arterial distribution, you may speak also about the risk factors. Risk factors is mostly in the diagnosis discussion. Is it clear? So that is how you make a diagnosis of ischemic stroke. You say stroke probably ischemic with mechanism atherosclerotic, cardioembolic, or lacunar infarct, and arterial distribution being, you say, the part that is affected. Now, if you have a stroke, your differential can be a stroke which is hemorrhagic. Is it clear? You can have a differential stroke which is hemorrhagic, and the hemorrhagic now, it can be probably etiology being an aneurysm. Is it clear? It can be an aneurysm, it can be an arteriovenous malformation and all that. Is it clear? Now, the next one, after the etiology aneurysm, we now speak about the territory of the hemorrhagic stroke. Generally, the territory, you can see the internal capsule, the left internal capsule, the right internal capsule, the left temporal lobe, the right temporal lobe. You can talk about the brain stem. Is it clear? You speak about the territory. After speaking about the territory, now speak about the complication. Generally, the complication of the hemorrhagic stroke is going to be raised intracranial pressure. You speak about the complication. Is it clear? That's how you make a diagnosis of stroke. Now, still on your diagnosis here, stroke, you first have CT scan to rule out the diagnosis, which is hemorrhagic stroke. You still have the CT scan to rule out the diagnosis, is it clear, which is hemorrhagic stroke. And when you rule out, you're going to see hyperdensity for hemorrhagic stroke. That's going to be localized. Is it clear? While in ischemic stroke, we are going to see hypodensity in an arterial distribution. Is it clear? Now, for subarachnoid hemorrhage, you're going to have diffuse hyperdensity, diffuse in the cerebrospinal fluid. Is it clear? In hemorrhagic stroke, we have hyperdensity, which is localized. In ischemic stroke, we have diffuse hyperdensity. Is it clear? In the cerebrospinal fluid, and then those are, and then for in the hemorrhagic stroke, we have localized hyperdensity. In subarachnoid hemorrhage, you have diffuse hyperdensity in the cerebrospinal fluid, and then the last one, you have ischemic stroke, where you have hypodensity in an arterial distribution. Generally, those are the different elements that you are going to visualize. After visualizing the diagnosis of the stroke, is it clear? We now move on to the second element, which is the cause. Is it clear? Now, provided that you have an ischemic stroke, is it clear? To see the cause can be, you can have laboratory investigation to evaluate the cause, the means of the investigation. You can either use the laboratory investigation to evaluate the cause, or you use the imaging investigation to evaluate the cause. Is it clear? Now, the first one for the cause. So let's say that the cause is ischemic. Is it clear? The cause of ischemic stroke. When you want to evaluate for the cause of ischemic stroke, when you want to evaluate for the cause of ischemic stroke, you need to know that there is atherosclerotic. Is it clear? And then generally, I've told you that what atherosclerotic stroke is coming from, generally from the internal carotid arteries. So in order for you to visualize the internal carotid artery, you use imaging means in order to visualize the internal carotid artery, and that is going to be a carotid. You do a carotid Doppler. Is it clear? And that carotid Doppler is going to help you if there are to know if there are plaques at the level of the carotid artery. Is it clear? That's atherosclerotic. Now, to visualize if the patient is having a cardioembolic stroke, is it clear? You first start by doing the ECG, which is an imaging mean. Is it clear? You start by doing ECG in order to visualize if there's an arrhythmia or any ischemic heart disease. And you can also do now a cardiac ultrasound. Is it clear? And a cardiac ultrasound is going to confirm that there's actually a thrombus inside the heart. Is it clear? That maybe have dislodged and gone at the level of the brain to cause cardioembolic. Then the next one is lacunar infarct. Lacunar infarct, in order to visualize lacunar infarct, you now ask for a brain MRI. Is it clear? So you ask for a cerebellar MRI at the level of the lacunar infarct, because lacunar infarct cannot be visualized with a cerebral CT scan, but it can instead be visualized with a brain MRI. Is it clear? So if you have a patient that has a stroke that cannot visualize with a CT scan, it means that it is either the patient had a transient ischemic attack 1, or the patient had a lacunar infarct 2, or the imaging was done within the first 3 hours of the stroke. Is it clear? The imaging was done too early in order for the stroke element, the stroke sign on the CT scan to be seen. Is it clear? Now, the next one, we have the cause of the stroke. So let's say now that the stroke was now instead a hemorrhagic stroke. Is it clear? So let's say that you have a hemorrhagic stroke. In case of a hemorrhagic stroke, now you need to visualize that what in hemorrhagic stroke we are going to have different causes. Is it clear? So it can be an aneurysm, it can be an arteriovenous malformation, it can be arteriovenous malformation, it can be meningioma, it can be an atheroma, it can be cavernoma. Is it clear? Or anticoagulation.